Hi everyone, good morning, happy Thursday, or Thursday, whatever. Depends on how your day's going. A lot of people are going back to school with their kids, and that's adding a lot of stress to the week. I'm raising my hand, but we'll get there. We'll get into a pattern of some sort that resembles normal, and it is what it is, I guess. But oh, happy birthday, Peg. Thanks for letting me know. Happy birthday. So, oh, the big 5-0. I just turned 45, the big 4-5. So I'm just a few years behind you. But it's exciting. I feel like mid to late 40s and cruising towards the big 5-0. It's like really good. I think it's been really good to me in terms of just, well, specifically in terms of do no harm and take no shit. That's kind of my motto, and I'm really feeling into that in my 40s and 50s. So hopefully that's I've never felt more like myself and more, comfortable. That's the word, in my body. So thanks for being here, Peg. I appreciate it. So I want to talk about trauma in the body, and not just trauma, but emotional pain or repressed emotions, past trauma, drama, wounds, pain, loss, big events, even if they're not negative, or if we don't label them as negative or perceive them that way, but big events that really have an emotional component, or repetitive experiences throughout our life that teach us that we're not safe, or that something is not safe, or that we don't have a support system. Like our beliefs even can really, they can really wreak havoc on the body. The physical body, the mental body, emotional body, energetic body, because they're all dynamically functioning as one whole unit. So I have a theory about feeling broken. I spent decades feeling broken, from the way I felt, the way that I thought about things, or even when I logically was in one mindset, sometimes like negative emotion fueled thoughts would alter my state. Like you're happy for someone, but you feel all this anger and confusion and things. All of my emotions were confusing during that time in my life. I had a hard time identifying how I felt. Everything was intense and it was overwhelming. And what I didn't realize in that moment, in that time of my life, was that I was like floating, stewing in my past pain and trauma. And for me, how that looked was that I spoke of it often. Everything brought me back to that. Every experience, I related it back to my pain and trauma. And so I couldn't experience the moment for what it was. I experienced it the way that I had perceived it or experienced it in my past. And it created a lot of suffering. And as a human being in a very physical body, in a physical world on this planet, it's impossible not to feel pain of some sort. Even our emotions, we can feel physically painful sometimes. But suffering is optional. Suffering is often something that, suffering is an indicator that we are looping through our pain cycle over and over again and unable to break it. And so it tends to show up in the body because we store those emotional memories, those emotionally charged energies, emotionally charged beliefs in our physical body, and our body patterns its physiology and biochemistry according to those repetitive experiences that are emotionally charged. So even thinking in terms of my daughter had a series of significant losses in her, I think she was about 3. And those stayed with her for a very long time. I mean, I still sometimes see that pattern resurface. It's a process to unwind it, and for her, she's still young enough to, that we don't just dive in the same way that I would with somebody who was coming to me saying, can you help me unwind this trauma? But my own trauma has manifested in the form of numerous symptoms in the past, and a lot of it I didn't even know what it was. But I've had, even beyond trauma, I had a lot of internalized anger in my younger years, and it manifested as a nonstop series of kidney stones for about 15 years. Not just one at a time, but sometimes 7 or more per kidney at a time. And that is just one way that anger can show up. Anger, inflammation, those two things have a tendency to be related, but inflammation can actually be related to any emotion stored in the body or any trauma stored in the body. And the thing about inflammation is that it can cause us to manifest a number of symptoms, from allergies to autoimmune illnesses and symptoms to affecting blood pressure and anything to do with the metabolism, or metabolic disorders like diabetes. Let's see. We know that trauma affects the body in terms of it puts you in survival mode. And if you had a lot of trauma, for instance, like we all experience some form of trauma in our lives, even if it's just a loss of a loved one, and I don't mean to minimize that, not just that, but what I mean is that it's not, a loss of a loved one can be traumatizing. But there could be also, some big event, like, if you were to experience some type of major war or catastrophe, that's a major trauma as well. Being rejected, especially in early childhood, that's a type of trauma. You really can't label trauma as, ranking in what's a worse trauma or a minor trauma. There's variations of trauma, and it's very individualized to the person experiencing circumstances. So we know it affects our primal brain and our survival, puts us in survival mode. And let's see, survival mode is just like affecting your autonomic nervous system. So it's any systems that function without your having to think about it. So digestion, muscles, nervous system, immune system, urinary system, all of those systems and more are affected by trauma, by any type of stress. So hi Kim, I see your comment, I just saw it. So common symptoms that can be, I shouldn't say are, but can be related to trauma or PTSD or CPTSD are ringing in your ears, weight gain, digestive issues, let me see, high blood pressure, heartburn, reflux, irritable bowel syndrome. You may have adrenal gland related issues like excess cortisol, inflammation, allergies, a histamine response, like histamine allergy or intolerance. You may have chronic pain or chronic fatigue. And you may have circulatory issues as well, like maybe you have really cold hands or feet because you don't get good blood flow to the extremities. You may find that you hold your breath often, or that you can't take deep breaths. You may have skin issues, like a lot of acne eruptions, eczema flare-ups, or other irritations or things on the skin. You may startle more easily and have a difficult time recovering from like fight or flight mode. Or you may have be in freeze mode more often, where you have a difficult time with like executive function, with being able to follow through with tasks and things like that. And you may yawn a lot, or even get the hiccups a lot compared to other people around you. So those are just some of the common ways that trauma can affect your body. Yes, I do work with symptoms related to PTSD or CPTSD, and I am a trauma-aware practitioner. Trauma awareness, trauma-informed practice is built into the modalities that I work in, and I have trained and certified in that, so as to not risk re-traumatization. And sometimes because of that, because I'm intuitive, and this modality that I work with is an intuitive modality. It's energy-based or integrative whole care healing system. So you're looking at all levels, not just looking at the physical symptoms or the emotional, but all of it, to integrate it down into the physical body for feeling better and helping the body heal the way it's supposed to. Because of that, re-traumatization is something that really we have to be careful about in this type of integrative intuitive practice, because people, and in my opinion, any spiritual or energetic practices, it should be built into the training, because sometimes things come up like familial or ancestral trauma, or maybe past life trauma or something, because those things are passed along intergenerationally through our genes. They're active in our DNA and our genetic code according to epigenetics. And because of that, and the intuitive component, sometimes people are like, oh, okay, well, was it something that happened to my great-great-great-grandmother and it was really horrible, and like all these details, and they want details, but sometimes I'm not able to give them, because I know it can be fun to explore some of those intuitive insights from past stories, but those stories they could re-traumatize. They could reconnect you to the trauma or the pain, and the whole purpose of working with me is to disconnect from the pain and repattern in a way that's supportive of natural healing right now, so that those emotional ties to past experiences are neutralized, possibly released. I'm not a fan of the word let it go, or the phrase let it go personally, but and release. Mostly we're neutralizing the neural pathways from that emotional charge from trauma, whether it's and whatever the diagnosis, PTSD, CPTSD, or anything else, the work that I do, it doesn't diagnose, and it doesn't, I guess, it's potentially a way to free yourself from those diagnoses. There's definitely an ethical component to following the protocol in terms of trauma-informed care in this kind of work. So hopefully that answers that question. But I do work with I can work with anybody with any symptoms or any diagnosis and uncover the underlying causes. And it's not always trauma, but there's often an emotional component. So beliefs are basically created, and I'm talking subconscious beliefs, not the conscious beliefs that you are aware of, but other ones that often have to do with how you see yourself, how you feel like you fit in the world, what you believe you deserve, how you deserve to be treated and valued by others. Those are like the deeper level subconscious beliefs that we kind of learn through conditioning, through our experiences, through what other people tell us. But let's see, I do want to talk about, what do I want to talk about? Let me just check my notes really quick. I have a little outline so that I don't ramble on with everything. Oh, so something that I should say that is really important. The work that I do is an alternative method of healing trauma, an alternative to working with a healthcare professional, a talk therapist, a behavioral therapist, and all of those professionals and all of those practices are fantastic if that's what works for you or if that's what you need. And you should absolutely do that and even incorporate more than one type. I mean, you can work with a talk therapist or a behavioral therapist and work with an intuitive healing modality that is trauma informed and will work in a, I can't think of words right now. I'll get there. I seriously cannot think of words. My brain just went blank slate. Anyway, integrative energy practices, such as what I do, working with trauma, work with the other treatments or professionals, whether it's chiropractic or psychologist, talk therapist, a counselor, whether you're taking medication for anxiety or depression or anything else. It's complementary. That's the word I was looking for. It's complementary. Everything works together. It's not separate, and it's not working against. Like, if you work with me and you're taking medication, it's complementary. I'm never going to tell you stop taking medication, because that would be utterly unethical. And I am not a medical professional, so I would be way outside of my experience, and it would be crazy. Let's just put it that way. So I encourage you to do what your doctors tell you, and then if you're feeling like it's not quite everything you need, that's because it's treating you from a mental perspective or from a physical perspective, and you may need to get in there with the emotional and the energetic to address the whole you, and that's where I come in. And some people have a lot of success working just with someone who works with whole care. You don't have to seek other practitioners, but if you are already working with someone, it's important to know that's great. That's okay. Keep doing that. As long as it's working for you, keep doing it. And ancestral trauma, I do want to talk a little bit about that, especially because the field of epigenetics is really discovering that we actually inherit the genetic predisposition to certain illnesses is not what we used to think it was scientifically, okay? It is likely, like, we all have genes that are active and inactive, some that are on, some that are off. And depending on how you're expressing your genes, active or inactive, depends on what kind of illnesses that your ancestors have had that you may potentially manifest. And it's not set in stone that if your parent or grandparent was diabetic, had heart disease, had a certain illness or issue, that it's not a guarantee that you're going to get it. And part of that comes from choices to live a different lifestyle, eat differently or better, move your body more or in different ways. If they all smoked, maybe don't smoke. If they all drank a lot, maybe don't drink a lot. You know, if you follow in the same footsteps, then you are increasing your chances in terms of behaviors and choices that we consciously make. However, a lot of those genes are expressed the same way because of the experiences of our ancestors. So if someone endured, like if their ancestors were slaves and they were grossly mistreated and abused and harmed, that is passed on generationally, and that trauma is still experienced in their great-great-great-grandchildren. Same thing with, you know, and I'm only picking big things like slavery and Holocaust survivors, but even smaller events from the past can have a traumatic impact on our genes, and we can be expressing those the same way that our ancestors did, and be carrying trauma inside us that doesn't even technically belong to us. And it can be affecting how you feel in your body. It can be affecting how you interact in your relationships with yourself and with others. It can show up in a lot of ways. So some other things, I just want to talk about a few things. I was going to give an example of my own trauma, but I honestly can't think of it right now. So I'm going to give some other examples that I've witnessed frequently. I see that people who were experiencing a lot of like the trauma of abandonment, or not having kind of like being a child that had to be the adult or go it alone. So whether your adults, your parents were absent, or if they were just avoidant because of drug or alcohol use or things like that, that type of trauma from the childhood, I see that show up a lot in the low back, hips, and sacrum, feeling like there's a lack of support. There's not, it's like a foundational symptom, like you didn't have that structural foundation growing up because of those traumatic experiences, and then it manifests in the form of low back pain, hip problems, and things like that. I see heart disease, whether it's hypertension and or things like that. I see that symptom come up when there's a maybe a resistance to being open and giving and receiving love, like a little bit of an emotional shutdown for the reason of protection because of past pain and hurt and trauma. I also see diabetes being related to past trauma, not feeling safe. Maybe either having to anticipate the needs of people, like walking on eggshells, or various other types of abuse or trauma that was fairly significant. That I do see diabetes. Diabetes has a tendency to be like related to there being no sweetness left in life, or having to adapt in such a hypervigilant state all the time. But it affects the body that way. And it can affect the body in various ways. I'm just giving some examples, just so you know. So if you have any of the symptoms or have issues with any area of your body that I just spoke about, that doesn't necessarily mean it has to be that. But those are very common experiences that I have witnessed in the 12 years that I've been doing this. And I just wanted to provide an example, like a framework of, cause and effect, basically. So emotional cause, physical effect. And emotions and emotional trauma don't actually just affect us physically. Like I said, everything functions dynamically. So your physical body, mental body, emotional body, energetic body, they're all functioning dynamically. And if one is disconnected in some way or out of balance in terms of communication, synchronization between the other parts, which is very common with trauma, because there's a tendency to disconnect energetically from the body, like kind of be up in your mental space or just slightly offset from the physical body energetically. And the reason for that is because it doesn't feel safe to be in your body or to be in the physical form or to be in the world when there's been certain types of past trauma, especially if the body stays in fight or flight mode for an extended period of time. You have to relearn how and retrain the body to feel safe in this moment right now, when you know you're safe mentally, but your body still doesn't feel that way, in order to disrupt past patterns and create a new physiology that allows you to be in alignment and balance and communication. And then all of your natural healing mechanisms start to function at a more optimal level, the way they're supposed to. So you can be in homeostasis or allostasis, which is when your body knows how to shift back and forth properly from stress to not stressed. Okay. So I wanted to talk about all this, and then I definitely want to invite you to ask questions, even if not just during this call, but if they come up in the next week or so, ask your questions. I am always open to answer questions. And if it's about you personally and about what's going on, or about how I can help you, I'm happy or whatever, or what kind of help you really need, because there's not a one size fits all for practitioners. But if traditional ways haven't been working and you're ready for something new, or you just feel like, oh wow, this makes so much sense to me, I'm ready to do this, I'm happy to talk to you about it and guide you in a way that's right for you. I am doing a group session for healing trauma in the body. And it's not going to be a deep dive into your individual things, but it does have a powerful outcome, because when we come together in a group, we all bring this like collective, we're kind of sharing space, and we create a collective energy that's really intense and really powerful for healing. Not to mention that we're all present online, and we're engaging, and so we're all observing what's coming up during the session for everyone. And you take away what you need, and it can create some really powerful shifts in your physical body and your emotional body. It starts in the energy and it trickles down. So if you're curious about this, it is a great way to see how it works and not have much of an investment. Of course, you are totally worth any investment or commitment that you make to yourself, because the more we learn to hear the voice of our body, and our voice is through our symptoms. Our body communicates through symptoms and issues and aches and pains. But if we can learn to hear that and then know what to do, it can really help you feel more in control of your comfort level from day to day, and help you pause between when something happens and how you respond that maybe loops you back into an emotional or a mental pattern that's really rooted in the past. So it's just a really great way to help yourself feel better, and to feel like you have some influence on how you feel. Because the truth is, we all have way more influence over how we feel than we've been led to believe. And once you can experience that, it's really powerful. And that's what I do, is I help people experience that. So I don't just do energy healing that you feel good for a while, and then, in a day or a week, you kind of go back to how you were feeling. We really get to the root of it. And if you take the actions that I present to you, and you do some of the work on your own in between sessions, you really make progress fast. And in like 3 or 4 sessions, you can really have a completely different experience or outcome. So, and start creating a more comfortable outcome, like where you process things and you recover faster. It doesn't mean that you're never going to experience ups and downs or discomfort, because of course we're human beings. We've experienced physical discomfort from time to time, and we get blindsided with things that trigger emotions sometimes. But if you have a way to help yourself through that, that's my goal, because it's a game changer. It really is. It's the difference between struggling and thriving, or surviving and thriving. It's really nice to know that you can sometimes, and the more you practice it, the more you influence it. That way we're not just influenced by everything that comes at us all the time. We start to, we get influenced, and then we influence back, and we shift, and we're like, you know what, I'm okay. Everything's kind of returning to normal faster than it used to. And that's pretty good stuff. So, oh, the group session is August 27th, and that's at 7:30 p.m. Eastern, and I'll make sure that there's a link in the comments. And you're welcome to join me. I think that would be awesome. Or like I said, just ask your questions, and know that I am here to help in any way that I can. So thank you all for joining me today live. I am going to be back again live tomorrow, I think. I just don't remember what for again. I can't remember the time that I'm going live and what I'm going to talk about, apparently. But hey, I'm just going to show up. And I hope to see some or all of you if you're able to join me. And meanwhile, have a great rest of your day, and I will see you soon. Bye.